look at the radiological features. Radiological features, and this is going to be of various GI disorders, that is a gastrointestinal disorders. So to begin with, firstly we look at the duodenal atresia. So duodenal atresia. So duodenal atresia, it appears as a double bubble sign. So there is a double bubble sign. Next we look at the jejunal and next is the jejunal and the ileal atresia. So what happens in the jejunal and the ileal atresia? So here there is multiple air-filled fluid levels. So there is multiple air fluid levels, and there is a plain erect X-ray abdomen on the plain X-ray. So on a plain X-ray abdomen. So the presents as a triple bubble sign. So it presents as a triple bubble sign. So next, as we move on, we look at the congenital hypertrophic pyloric stenosis. So we look at the congenital hypertrophic pyloric stenosis. So here it is a single enlarged. So it appears as a single enlarged and a gastric bubble. Single enlarged gastric bubble. Then we move on to the sigmoid volvulus. So sigmoid volvulus, it is common. It is appearing as a coffee bean sign. Then we move on to the achalasia cardia. So in terms of achalasia cardia, this is nothing but a bird beak sign. It appears as a bird beak sign. Next we move on to the small bowel obstruction. The small bowel obstruction. So in terms of the small bowel obstruction, the obstructed bowel loops, they are central in location. So the bowel loops, if you see the bowel loops, they are nothing but they are central. They are central in the location. So they are central in location and show a valvulae and it shows a valvulae coniventus. So what does it mean? It means that there is a mucosal fold. So there are mucosal folds and that cross the entire diameter of the bowel. So they cross. So it crosses the entire diameter of the bowel. So the characteristics of the jejunal involvement. So it shows the characteristics of the jejunal involvement. Next we'll move on to the large bowel obstruction. So what happens in case of the large bowel obstruction? So in terms of the large bowel obstruction, this is the presence of ostrations. So there are presence of the ostrations. Ostrations is the feature of the large bowel obstruction. Ostrations folds are irregular and do not cross the entire diameter of the bowel. So they are irregular and do not cross the entire diameter of the bowel. So it does not cross the entire diameter of the bowel. So they are absent in the cecum. So other important point is that it is absent. It is absent in the cecum. Next we'll move on to the cecal volvulus. Next we move on to the cecal volvulus. So in terms of the cecal volvulus, there is a presence of the cecal dilation So there is a cecal dilation and a single air fluid level. There is a single air fluid levels, and it extends into the left upper quadrant. It goes up to the left upper quadrant, and an absence of the gas in the distal colon. So there is absence of gas in the distal colon. So there is absence of gas in the distal colon. Then the colonic hostrations are well maintained. So there is also colonic hostrations. The colonic hostrations, they are well maintained. Next we look at the midgut volvulus. So what happens in the midgut volvulus? So in terms of the midgut volvulus, there is presence of the corkscrew appearance. So there is corkscrew. So corkscrew appearance, and it shows the duodenum and the jejunum. So this shows the duodenum and the jejunum. Next, there is a spiraling around the mesenteric vessels. There is spiraling around mesenteric vessels. So the spiraling around the mesenteric vessels, and this occurs in the upper GI contrast studies. So this appears in the upper GI contrast studies. It appears in the upper GI contrast studies. Next, we will move on to the necrotizing enterocolitis. So now we are going to look at the necrotizing enterocolitis. So in short, it is known as the NEC. So this is nothing but there is an abdominal X-ray finding. So the abdominal X-ray, what does it show? It shows a pneumatosis. So it shows a pneumatosis intestinalis. So this is nothing but the air in the bowel wall. So air in the bowel wall. Next, we look at lastly the CF, that is the cystic fibrosis. So the cystic fibrosis is the abdominal X-ray. So here the abdominal X-ray, it with the contrast edema. So along with the contrast edema, so it reveals a microcolon. So there is a microcolon, and with plus a severe meconium plugs. So there is also severe meconium. So there is a severe meconium plugs. So this was about the radiological findings in case of various GI disorders. To learn and grow daily like this, please do subscribe.